What if that nagging feeling of, am I really doing everything I can, could be replaced with the absolute knowing? And instead of doubt, you could just focus on the task at hand, getting you closer to your dream of parenthood. Wouldn't that bring awesome peace of mind? My patients definitely think so. And on this journey, understanding the investigations and the diagnostic tests that are going to help get you closer to your dream of having a baby is what today's segment is all about. Hi, I'm Gabriela Rosa. I'm a fertility specialist. I'm a Harvard University awarded scholar. And for the last 2 decades, I have helped couples overcome infertility and miscarriage, even when other treatments have failed. And recently, we've conducted a retrospective analysis of our patient data to discover that our program and our method has an over 78% success rate. Having now helped and educated hundreds of thousands of couples in more than 100 countries, I feel like I've learned a couple of things that can help couples just like you who are still on that journey to your baby to have some extra insights that might help along the way. And I hope that I can share those with you today. And, given the fact that in our practice, we specialize in difficult and complex cases, typically treating patients who have tried what they feel like is everything and nothing has worked, and who then go on to have healthy babies as a result of our method, it's really such a wonderful privilege to feel like that there is a little bit that I can add back and help you as well. So before we do get started, I'd love to know, where are you watching from? And just on the comments below, just, if you're on Facebook or Instagram, I know that we're live on both today. We're still working on our multi-live stream platform, and it's coming. I think that next week might very well be the week where we go live across many more multiple platforms. So that's going to be pretty exciting. But in the meantime, if you're watching on Facebook or Instagram or wherever it is that you're watching, let me know, where are you watching from? And, obviously say hi. That would be fantastic. So let's begin. And, before anything else, as always, I like to make sure that I acknowledge you for showing up. Like any time that we're pushing through comfort zones or we're doing something that's new, it's easy to feel a little bit scared. It's easy to feel a little bit like, oh my God. Often people get really stuck on this idea of, what if I find out something that I'd rather not know? I don't know about you, but I always like knowing, right? So if you're here being brave, I commend you, truly commend you, because the sooner that you break through that, kind of almost glass ceiling of, I don't know what I don't know, the closer you actually get to your ultimate outcome of holding your healthy baby in your arms. And that is exactly what I would love to help you achieve. Most people, absolutely, and I know this to be true across the board, most people choose to almost ignore the fact that only they can take charge of themselves to transform their results. It's inevitable. In fact, having now conducted multiple programs with patients all over the world, I know that to be true. So for you guys who are here listening, watching, learning, welcome, and huge congratulations. So as always, I like to make sure that I cover a topic as in depth as I possibly can in the time that we have. And so for that purpose and for that reason, what I do is I kind of just make sure that I get all of your questions, that I can think of that are the most frequently asked. And I can see lots of you saying hello on Facebook. That's wonderful. Instagram has been a little bit slow to tell me where they're actually watching from, but it's fabulous to see we've got people from the US, we've got people from Australia. Look at you guys. Love you. Thank you. Thank you for being here. Thank you for watching in. So some of the questions that I get asked very frequently. So let me just read through some of them and we'll, kind of make some sense. Oh, there we go. We've got Miami, Florida. I was in Miami literally 3 days ago. Huh, if I'd known, Blanca. So question number 1, my doctor has tested me and my partner and said that everything is fine, yet I'm still not pregnant. Am I missing something? what am I missing? You know, that's a big question that I often get asked. And what tests should I do to determine my fertility? What tests should my partner do to determine his or her fertility? Is semen analysis all that my partner needs to do? I don't feel like I've had enough tests. You know, who should I consult? Where should I go? Who can help me interpret the test results? And that is a really, really important question. We're going to talk about that in quite a lot of detail. I've been told that there's nothing wrong or there's nothing else to do, but I'm not ready to give up. What is it that you recommend I do? Will a GP be enough, you know, for testing, a general practitioner? Will that be enough to get all my testing done? My doctor has referred me to a fertility specialist and they too can't find anything. You know, what else do you recommend? What else am I missing? So, I can see Instagram has gone live. Lots of people are telling me where they're coming from. I've got Colombia here, I think. Goodness, how wonderful. So this is fantastic. So these are some of the questions. And of course, feel free to add your own, right? So as we go along, if there are specific questions that you want me to answer, I will do my very, very best. And I'm going to break all of this down into 3 big ideas that we're going to cover in the next 50 minutes or so. Feel free, as always, you know, I'll do my very best. If I can, I'll come back and answer in the comments below. I'll do my best to do that. And I'll make sure, as always, that I cover everything as in depth as I possibly can. So big idea number 1, are we ready? Are we ready for big idea number 1? And look at you guys. Oh, we've got Brazil, we've got USA. USA is always a huge part of our contingents, which is wonderful. There's a question here on Instagram. What can I do to help my husband improve his fertility? That actually, Elizabeth, is a fantastic question that I answered, I think it was last 2 weeks ago on the Improving Male Fertility Ask Gabriela Rosa Live. So if you go, and by the way, we now have a catalog that we've started with a whole lot of resources and, you know, like some timestamps of this particular session. So, or not this particular one, but, you know, all the sessions that I do run. So what I would recommend is look out for that catalog. I'm going to put it at the end of this session. I'll put it at the very top so that you guys can actually have access. But there is a talk that I did 2 weeks ago exactly on that topic. So how to improve male fertility was very much what I covered for an entire hour. So I would highly recommend having a look at that, and that will be very, very helpful. So yeah, you know, I love this. Eliza has said, you know, based on one of the questions that I've put in, we've had everything tested. And this is typically, you know, that this is the biggest issue, is that you go to a doctor and they say, we've tested everything. That is never possible. Just so you know. I think that we as a clinic, we run the most comprehensive testing protocols for our patients, and we do because, you know, typically by the time our patients have come to us, they have done literally everything else, right? And so, and it's sad that that's the case, because we could help so much more, you know, and so much quicker and easier if they hadn't done everything else. You know, if they came to us first and did all the things that we needed to do and get them through. But typically, unfortunately, we end up being kind of like the last resort. As much as I don't wish that would change, you know, that kind of like we've gained a reputation for being the people who can actually resolve issues like this. And so what ends up happening is that I hear this all the time. People say, you know, my doctor said they've tested everything. It is never going to be possible to test everything. And you'll see why that is the case when I talk about this in a moment, okay? And there are so many complications around that, but really personalized testing is one of the most important things that we can do in order to help couples overcome infertility and miscarriage. And of course, take home a healthy baby, because at the end of the day, nobody wants to be pregnant. Wouldn't that be true? I mean, let me know in the comments below if you just want to be pregnant. Of course, you don't want to just be pregnant. You want to actually take home your healthy baby. So in order to be able to do that, when there have been previous reproductive challenges and lots of things that has been done, or, you know, that you have tried that hasn't worked, then we need to look at things from a different perspective, right? We need a paradigm shift. And that's typically what I see for my patients, you know, is that often when they come to us, they're so ready for just going, okay, we've done most other things, and they still don't feel like they're complete. They still don't feel like they've really left nothing to chance and no stone unturned, hence wanting to do something new. But sometimes it's difficult to know because there's so much noise out there. Like one person says that you need to take, methylated B vitamins. The other one says that, all you need to do is go and do some infusion and you're going to take home a healthy baby. The other one says Amazonian monkey pee is the thing, breakfast, lunch, and dinner. Like, you name it, right? Use the bracelet and you're going to, like, I get tired. I get tired because you see, most of these questions then end up coming back to me, right? They come back to me going, is this true? Should I be doing this thing? And what else should I be doing? And typically, by the time people come to us, they're doing such a huge, long list of things that are mostly ineffective. And I feel so sorry for the waste of time, energy, effort, money, without having had the basics, the ground foundational aspects that need to be addressed, really properly taken into consideration. So hopefully, that's what I want to do today, is really get you guys kind of understanding what it means when your doctor says we've done everything and everything is fine, because everything is not fine. The only way really for you to know that everything is fine, right, is when you no longer have the problem that you're actually seeking support or help for. Which basically means that you are holding your healthy baby, you are going through sleepless nights, and you're in a completely different phase of your life, right? That is when we know that everything is fine. Does that make sense? Like, let me know in the comments below, because often people get this really wrong. Like they get so short-sighted and I guess tunnel visioned into this whole idea of, it's all about the testing and it's just all about the testing, and they lose focus and lose sight of what this is actually all about. And I know that it's very easy to do, right? When all you want is to be pregnant and hold your baby, it's so easy to cling to anything that you think might actually help you do that. But it's really important to be, I guess, objective, right? And really be able to understand the difference of what it actually means to be told everything is fine, just keep trying. Because again, like I said, if everything was fine, we wouldn't even be having this conversation right now, right? So, but anyway, that's a whole nother conversation that we can have and we can continue to have. But let's go back onto the testing, because to test or not to test, that is the question. And how do you address a problem that you can't see or that you can't quantify? Right? That is my first question to you, because, often people come to me, and what I said before in terms of people getting really stuck on that whole idea of, oh my God, like, what if I go and do my testing and then I find things that I, don't really want to know, or that scare me, or whatever, right? And you might not very well be in that position, and I appreciate that, and that's great. But for some people, that's a really big issue. And I like to cover that off, because you see, the question that I've just asked, how do you actually address a problem that you don't know you have or that you can't quantify? If you don't test, right, you're never really going to know. Even if you get a bad result, it's best that we know what that so-called bad result is, so that we can then do something about it. And very often, that's exactly what happens, right, is that we can do something about most things if we know what we're dealing with, right? And think about it. Every single time that you have got bad news or that, and across your life, right? Think about this across your life in general. Every time that you have had to deal with an issue or handle something that before you had to deal with it, you felt like, oh my God, I don't know that I can handle this. But you did, right? You did. Not only did you handle it, you survived, you made it, you moved on, you were strong enough. And I commend you. And I actually even go further and say that no matter what else comes your way, you will be able to handle it. So not testing for fear of what you might find is at best short-sighted. And unfortunately, I see a lot of men do this. right? A lot of men kind of feel like, oh my God, it's almost like they're deathly afraid. And gentlemen, I'm not trying to single you out, right? I'm just kind of pointing it out because fertility is a team sport. In order for us to really understand what's going on a couple's fertility journey and situation, unless we want to continue, you know, as I love to show my little diagram, unless we want to continue going around in circles, guess what? It's going to be really, really important that we understand what's happening on both sides of the equation. Because if we only have one side of the equation to go by, we're leaving 50% of whatever else we could be doing to chance, right? And that can mean the difference between having a baby or not, right? And so that is what's super, super, super key to understand. So for men who might tie in their masculinity with a result on a piece of paper, let me tell you, you're much better off actually facing it right on and going, okay, this is what I'm dealing with. Because for most things that we will find in diagnostic testing, and we also now know that male fertility and the quality of sperm is very directly linked not only to the ability of getting pregnant for a couple, but also the ability to take a healthy pregnancy to term. So miscarriage risk is doubled when sperm DNA fragmentation is very poor. Right, and in previous talks I've talked about this, so you will find the references for all of these in the latest scientific journals. But the reality of it is that unless you start to really look at things and piece them together to create, I often like to equate fertility to a 1,000-piece puzzle. We got really into puzzles in this household this year, or in my household, I should say. And this is essentially what happened. I decided that it would be a nice challenge. I have a 7 and a 4-year-old, and I decided that it would be a nice challenge to, as a family, put together a 1,000-piece puzzle. And this was basically on the backhand recommendation of one of my dearest friends, who is an avid puzzle kind of putter together a person, right? She's always kind of like dared me to go, I dare you to put together a 1,000-piece puzzle. I thought, well, I don't know that I could actually sit down for, 1,000 pieces and put them all together, even though that's exactly what we do for our work every single day. I didn't quite equate the two. But anyway, long story short, I decided to get this 1,000-piece puzzle and we cracked it open. The kids were very excited. And to my surprise, actually the entire family got into this thing. What's beautiful about 1,000-piece puzzles is that when you buy them in the shop, they come in this beautiful box. There is a very clear picture of what you are aiming for and what you are looking at the end of the day to create, right? And all of the pieces are in this box, okay? So that is a big win. That is a huge win, because guess what? When it comes to fertility and certainly overcoming infertility and miscarriage, it's like a 1,000-piece puzzle, but you don't have all of the pieces. You certainly don't have a box. And that picture in the front that you get to see what it actually should look like at the end is more like what you need to kind of put together as you go along. Right. And I equate it to, I equate fertility to a 1,000-piece puzzle these days, because what happens for our patients in this particular situation is that we don't always have an exact picture of what it is that we're dealing with in the beginning. It's almost like, you don't have all the pieces of the puzzle. And so you start to look for these pieces as you go along. And that's what testing is all about. We're actually asking questions and looking, exploring to find these pieces. And as we find pieces, we start to look at them because we don't really know what that picture looks like. So we start to look at them and go, okay, well, could these two pieces fit together? And if they do, like how? And, then we go and find another few pieces over here, and then we kind of try and figure out, based on the colors and the tones, where they actually fit together, right? So this is essentially what overcoming infertility and miscarriage is all about. And testing is a huge part of that, because that's what's going to help us to be able to, kind of put those pieces together, or at least bring them in some kind of cohesive fashion together so that we can start to put them in some kind of similar or, objective form. Does this make sense? I hope it makes sense. Give me some love, give me some likes if this is making sense, because, you know, like sometimes my analogies do need work. And I don't know if it all makes sense all of the time, but hey, you know what? I do my best, as I always recommend my patients do. So, you know, it's great. Okay, you guys are getting it. This is good. At least on Facebook, people are getting it. I hope you guys are getting it on Instagram as well. But when we have that, right, when we have that understanding, then we need to start looking at, okay, what are all of the things that if we were to have more of these pieces, what are the pieces that are actually going to make a difference? And by the way, Teresa Clark Logan, I just want to say, I changed this whole topic this week for you. Okay, because you asked me the question about what testing I should do. And I thought I would just single you out with love. And let you know, this one's for you, my darling. This one's for you. So it's for all of you, of course. It's for all of you. But I thought it was a really great question, you know, that Teresa asked. And of course, for those of you who have done the Fertility Challenge before, and I'll talk about the Fertility Challenge a little bit more at the end of this. It's a completely free event. It's a fantastic event, actually, that I highly recommend you attend. But if you've done the Fertility Challenge before, you will see that I go in depth, as well as, of course, in the book. Right, in my latest book, I go in depth into thyroid and thyroid testing, because it's such an important part of this whole equation. But it's an analogy and an example of all of the things that we could do to really look at, you know, one area. And so what happens with the whole picture of fertility or infertility or miscarriage is that then it kind of branches out from there. And we need to obviously be a whole lot more detailed, you know, as we go along. So yeah. Oh, look at that. And you see Hashimoto's. So Lizzie on Instagram tells me that she's done a whole lot of tests done, and the only thing that was found is that I got Hashimoto's. Well, you see, that is a pretty big, massive thing. You know, when you look at the grand scheme of what Hashimoto's means, you know, taking into consideration that it's also an autoimmune condition, as well as a condition that impacts your thyroid and your thyroid hormones, which in turn will impact all of your reproductive hormones, not just your metabolic hormones. It's huge in the grand scheme of fertility, right? Now, why do I say that? Because it increases your risk of miscarriage. So often for couples or women in particular, but also this affects men and sperm quality. But for women who are typically diagnosed with Hashimoto's and feel like they've been trying lots of different things, nothing has worked, don't necessarily get a positive pregnancy test. So they think that it's just infertility, but, you know, not really anything related to miscarriage, can be really quite confusing to, you know, figure out that you may actually even be conceiving, but what's happening is because of Hashimoto's and because of an uncontrolled metabolic picture in terms of biochemistry, you're actually not able to keep that fertilized egg and, you know, developing and, of course, becoming the embryo that we want to see leading up to a positive pregnancy test. So 1 in 4 pregnancies end in miscarriage even before a woman knows, or before a due date, you know, before a period is even due. So understanding, you know, like sometimes we might find things through testing that we go, oh, that was minor, that was nothing. Or even, you know, and this happens so frequently, you know, like somebody might have a elevated TSH. So let's go on the thyroid, because obviously this is a thyroid conversation. They might have an elevated thyroid stimulating hormone test, and, you know, the doctor basically just looks at it. It's mildly elevated. You know, the range is huge, by the way. So basically, you know, it's 0.5 to 4.5 IULs per liter. And so basically, you know, you don't know whether, even if you are, what we know, and certainly this is based on the research and on the science, that anything above 2.5 increases the risk of miscarriage. So at any point where I see anything like at a 2.3 or above, I'm really getting quite, you know, concerned for that person, because I want to see, okay, what's actually happening here. But what happens is, because that is right in the middle of the range, right, at a 2.5, most doctors will do absolutely nothing about it. They won't test further, which really it actually needs to be done in order to be able to understand Are we dealing just with an elevated TSH, or are we dealing with an autoimmune condition? So, those are all questions that if we don't screen properly, we end up not being able to answer. And when we can't answer those questions, what ends up happening is that we end up going around in circles, right? So is this making sense? I hope this is making sense to everybody, because it really is such a very key. It may seem like it's just so simple, right? Like, oh, of course I knew that, or whatever. But let me tell you, the actual practice of not only understanding what it means, but how to treat it is the key. Okay. And that very much, that has to be done in a very personalized way. And it's outside of the scope of this conversation today, but certainly such an important topic to be able to really get your head around. Okay. And yes, like this comes into all sorts of different things, from biopsies that you would do for natural killer cells or whatever else. And we'll talk about the different types of testing. So, who should I go for testing is a very big and important question. And it is a question that literally opens up an entire minefield. And I'll tell you why. Most general practitioners, and I know this because we deal with patients and we treat patients from literally all over the world, right? In every continent other than Antarctica right now, we have patients. The majority of our patients are in the US, UK, Australia, Asia, but really we have patients in South America, South Africa, Europe, you name it, okay? So what happens is that we get to talk to and engage with doctors from all over the world, right? And in all sorts of different types of specialities. And what I know and what I see is that when we write a very specific letter of referral, because we've gone through a whole lot of work to figure out what it is that we need that specific patient or couple to get tested, and very frequently we get met with, what is that test? I have no idea what that test is. Right? And it's a test that we use routinely all the time. Then I know that we're dealing with a doctor who obviously that area of treatment is not necessarily their speciality, which is perfectly fine. But you see, most patients would have no idea. So what happens is that you might go to a doctor who you think should know what it is that they need to get tested, and they're very well-meaning and they're very helpful and they want to see you succeed and they want to see you have the healthy baby of your dreams, but they too don't know what they don't know sometimes. And so what happens is, because it's not their speciality, so what happens is they will go and they will do what tests they know and what they think needs to be done for that particular situation. Results will come back, nothing kind of too out of the ordinary will show up, right? Because again, what we're looking at, like the thyroid example is a perfect example, where in a lab result, you will have such a wide range that nothing will actually show up as being pathologically abnormal, but it's functionally abnormal. And so what ends up happening is that for that couple, they're just told everything's fine. So we've done all the tests that that particular doctor knew to do, and everything is fine. Can you see? That is the huge dilemma that thousands, if not millions of patients go through when it comes to fertility testing, okay? Because we're not really quite having a good gauge of, one, what is everything? And really, what does it mean in the grand scheme of, all of the results that I could have? And what does it mean in terms of pathological versus functional impact? And is it enough that something is subclinically abnormal, for example, a TSH of over 2.5, but within the 4.5 boundary, right? What's actually normal and what is abnormal is the question. Because for that person, for that specific person, even 2.5 might be completely abnormal. They might be having lots of symptoms, irregular cycles, weight gain, hair loss, or you name it. Lots of different types of things might be going on, which for them is not normal, right? But on paper, it looks fine, right? And that's the problem that I have with that, we've done everything and everything is fine. And that's why I say, in the very beginning, I said before, I'm not okay with using the piece of paper as everything is fine measure, because really, if everything is fine, you should have a baby in your arms right now. That to me is when things look like everything is fine, when the problem is resolved and you've taken home your healthy baby, right? So that's what we work towards. So that's big idea number one is, to test or not to test. How do we go about it? Who should we go to? And how do we figure that out? Then big idea number two is, now that we know that we need to test, what do we actually test for? Right? And we've talked about this whole idea that, everything doesn't normally mean everything. There's 4 major reasons as to why people, when it comes to fertility or otherwise, will get tested. One is for screening or diagnosing, right? So we want to know, is there a problem? What is the problem? Then there will be a prognosis type question that sometimes comes up if we find that there is an issue. It's like, what is the likely outcome of this condition, or what is the measure of severity of this particular condition, right? Then there's another reason as to why we would test, which would be to prepare for treatment. And anybody who has ever gone through any kind of drug cycle will know that, these kinds of tests happen to monitor your cycle, to monitor what's going on, to monitor when you should be coming in for whatever it is that you need to do next, and when you should try to conceive, and so on and so forth. So preparing for treatment can also sometimes basically cover that whole idea of, what do we do in terms of, for example, STIs, right? Might be a test, a lot of tests that get tested in order to be able to understand, can we actually proceed with an IVF cycle? Because if somebody has a sexually transmitted infection, then what's going to happen with that pregnancy? Most likely it's going to fail. And of course, can put the person as well as the embryo and developing fetus at risk. So, preparing for treatment is definitely going to be part of that whole thing. And then monitoring health conditions is the kind of 4th major idea. The problem with all of these, right, is that often all of these tests are done very superficially. Okay. So whereas, and again, I mention it, because in the fertility challenge in the book, I talk about thyroid, and we've talked about thyroid already. We might as well just go with that example. But there would be at least 30 different types of tests that if somebody came to me and we really wanted to diagnose and to screen, diagnose, prognose, we would actually look at a whole lot of other things, not just TSH, right? So that being the case, there's like almost 5 stages in terms of testing that needs to be done for you to know that it's being done properly. And I'll share what that is so that you can actually start to reverse engineer what you have had done and how that has actually, how does it fall in the grand scheme of what it is that you're trying to achieve? Because the likely thing that happens, and this is what I see very, very often, is that not only tests aren't done comprehensively, but when they are done, the 3rd step out of a 5-step process doesn't get done. So a proper 5-step process for testing looks like this, right? Step number 1 is that we go and we do comprehensive testing that is personalized, that takes the whole person into consideration, that takes their entire history into consideration, but also that takes their partner's history into consideration. If you don't know exactly what I'm referring to here, I would highly recommend that you listen to the talk that I did on egg quality, because egg quality is a perfect example of how testing gets done so badly, right? What happens is that a woman will be tested, they will be sent for an AMH, typically, maybe an FSH, and if they're sent to be done that on the right day, which should be day 2 of the cycle, right, for both of those tests, if that happens, fantastic. At least we've got one little tiny part of the process actually done semi-properly, okay? And so what happens is that you go and have that test done. You get a result. And the result might say that AMH is low for your age, FSH is slightly elevated, and that is where a woman is then told your eggs are no good. The quality of your eggs are no good. You'll probably need donor egg, right? Anyone here familiar with that situation? Pop it onto the comments for me, because I hear this story more times than I would ever like to recount, right? But that's what happens. However, what we know very, very clearly is this: it's the egg's responsibility to ensure that the sperm is addressed in the best possible way when it comes to, you know, the errors in its DNA. Actually, the responsibility falls back on the egg to address all of the DNA fragmentation, of the DNA issues that is within that sperm when it enters and fertilizes the egg. So what happens is, if the egg is perhaps struggling a little bit, or it doesn't have the energy production capability that it used to, right? The fact that that sperm is not the absolute best quality that it could be is going to literally let the team down, right, in the ability to take home a healthy baby. Okay, and lots of you are saying, yes, that's exactly what I've heard or what I hear. So this is important, because you see, making sure that you have the comprehensive testing done isn't just to do with that person in that moment in time. It has to do with their history, it has to do with their partner's history, it has to do with all of the things that brings that together in order to overcome the problem that we're dealing with, right, in order to actually have a different result. So comprehensive testing is the first step of that 5-step process. Then the second thing is that we want to look at the results, right? But therein lies a very tricky problem. And that is this: often patients expect the results, and doctors will deliver the results, and that's where it ends. You know, the results are okay. Everything is fine, right? There's nothing to be concerned about. Just keep trying. But there might be a slightly elevated TSH or a slightly elevated prolactin level, or, you know, prolactin obviously is going to also regulate the cycle. There might be, you know, nutritional deficiencies that get picked up, and, you know, you name it. There might be lots of other little kind of minor things, nothing too extreme, but that start to compound as they show up in those subclinical ranges, right, that we talk about. And so what happens is that at that point, really further testing is required. And look, let me give you just a little bit of an example. Prolactin is a great one, and we'll talk about, you know, the different types of categories of tests in a moment that you can have. But prolactin is an important one, because when you get an elevated prolactin, what we need to do could be various reasons as to why that happens. I mean, your prolactin might be elevated because you have a pituitary tumor, which is a brain tumor, often treatable, but certainly something that needs to be treated. Another reason as to why prolactin might be elevated is that, you know, when you actually went to have your testing done, you were rushing around and getting lots of things done, and you get to the pathology lab, and the pathologist basically, you know, takes you into the room and proceeds to take your blood, you know, draw your blood straight away, and hasn't actually made you sit for 15 minutes in order for your prolactin levels to kind of reach baseline, right? And that might be the very reason as to why the prolactin gets elevated in the result. But we don't know that until we actually take the next step, which is to retest, right? So when we get an elevated prolactin, we need to ask further questions. Sometimes, you know, if it's kind of borderline, it doesn't get asked. But I've seen this go wrong both ways, right? I've seen it where it was just really the pathologist that didn't let that person sit down for 15 minutes. And, you know, that's why the prolactin was elevated. And I've also seen it where it was kind of borderline, but we were dealing with a pituitary tumor, right? And so that's why we can't just accept that a result, even if it's borderline or subclinical, is going to be okay just because it's kind of within range, right? So the second step really is to look at those results and question, are there any further tests that we need to do? Okay. The third step, and this is such an important step, and I know for a fact that practically almost nobody else in the world does this as well as we do. And that is the correlation of test results, is literally putting it all together and seeing it almost like in a in a giant spreadsheet. Every single possible test that you've had done, every single date, every single result, how does it correlate? What is it, you know, what does the hormonal test say in terms of what do the genetic tests need to kind of eliminate us about in terms of, the biochemistry and the nutritional status and whatever else is going on in terms of infections and, you name it. So it's looking at all of those possible correlations that could lead us to think about, okay, well, what else do we need to? So it's that investigative process. It's actually looking for and understanding, where do we even start to look for those pieces of the puzzle? Because if we don't have that place to go by or to go from, guess what? We continue going around in circles, right? And that's really what, for my patients, I absolutely want to avoid, because they've already gone in circles enough. Right? So the correlation of those results, how they relate to each other, what does it all mean, is hugely, hugely important, gets missed all the time, right? And so if you know that you have had some tests done, but haven't had retests, haven't done, haven't kind of gotten a better picture of what's going on, and certainly haven't had your results correlated, guess what? Like, everything is out of order. Right? We're looking at a process that's broken. And when the process is broken, guess what? Are we more likely or less likely to have a baby? Are we more likely or less likely to run out of time altogether? Right? That is really what I'm always thinking about. And I'm thinking about that in terms of like family planning. I'm thinking about it in terms of like, okay, this person has come to me, they've already been trying for years, right? They would ideally like to have 2 children. What's our timeline looking like? If we don't like hurry along here, right, we're going to run out of time altogether. And this is why I say to people, when people come to me and they've either done a fertility challenge or they've been following me for like 2 years, I think, gosh, my God, act, right? Because 2 years is a long time that we could actually be using to get results, right? As opposed to just kind of going around. So that's number 3, step number 3. Step number 4 is then really understanding what is going to be, and this is, as far as I'm concerned, one of the most important areas, is what is the effective treatment that is required for those correlated results, okay? That is going to be crucial, because sometimes cookie cutter is what happens, right? It's like every person with an AMH below whatever gets this protocol, right? Doesn't work like that. Doesn't work like that, because we might have a very different picture. For every minor factor or obstacle to optimum fertility, we might be dealing with a permutation that requires a different approach to address. Okay, so really that 4th step has to be personalized, customized treatment based on what it is that we find, as opposed to just some kind of, let's just do this because this is what we do across the board. Okay, so that's step number 4. And then step number 5 is monitoring. And I cannot emphasize enough how vital this is, because monitoring has to happen not once, not twice. It's an ongoing process of testing, retesting, adjusting treatment according to what we find. Right? And those are the steps that enable people to overcome infertility and miscarriage when everything else hasn't worked. So having the understanding of what is needed there is going to be critical, right? Is going to be crucial. So then it brings me to the next step, which is like, okay, well, what are the categories of tests? What are all of the things, because really there are thousands and thousands, literally thousands of things that you could actually test for, right? And permutations and variations are, gosh, I probably wouldn't say necessarily infinite, but, with the more we find and the more tests that enter the market and the more things that, we start to be able to actually understand about, and certainly with genetic testing these days, there is a lot. Right? Let's just say that there is a whole lot of things that we could be looking at, but there's certain categories of pathology tests that, we as a practice, as a clinic, we will make sure that our patients, go down the path of, depending on what it is that we find we need. And again, not every single test is going to be needed for every single person, because this is also part of the constraint, part of the issue. Tests are expensive. So what we want to be doing is we want to be utilizing resources effectively. So sometimes we'll skip doing a test that we know is very likely going to be abnormal if we can actually utilize that piece of resource to do a treatment that is going to be better in terms of an outcome. So sometimes it is kind of, we have to almost look at a pros and cons type situation, but we can never just pretend not to see what is there, right? Because we need to be making some very educated decisions on how to actually approach the utilization of resources in fertility treatment. Okay. And if we do that, then we're much better off and we're much more likely to achieve an outcome regardless. And sometimes we might delay doing a certain test because of cost, because we might look at seeing if addressing all of these other factors that we have found over here will be enough to prevent us from having to spend, that level of resource on this test over here. And sometimes that very much happens, right? But at other times, not so much. And sometimes we actually have to make sure that we are utilizing our resources in a testing scenario, because that's going to give us so much more information down the track. But there's lots of categories. So, there's there's 1, 2, 3, 4, 5, 6, 7, 8 things that I could think of from the top of my head that we would do. So bloods, urine, stools, bodily tissues sometimes, imaging, and of course there's a subset there which is surgery, but it comes under the other things. And so I'll explain those in a little bit. But from blood, of course, we can do serum, we can do plasma, we can do genetics. What we're looking for there is we're looking sometimes at hormonal levels, sometimes we're looking at nutrient levels, sometimes we're looking at immunological aspects. And immunological aspects can lead us from possible infections to autoimmunity to alloimmunity. There's a whole lot of different things that we're looking for there, as well as genetic variants, might be something that we look for in blood. So, all of those different types of things that can illuminate the path, again, based on what was previously done, based on history, based on couple history, is essentially then the choices that we make. And look, our testing protocol is huge, right? There are so many different tests that we could just tick, 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 tick. But we don't, again, because of resources, because of cost, but also because of wastage, right? Some people don't need to have a whole lot of things tested that we know are going to come back normal, right? So then we're really allocating what it is that we need to do. Urine might give us a whole lot of insights, from infections to nutrient levels to, biochemistry, how the body's operating in general. Stools, we're typically looking for, gut issues. We're looking at parasites. We're looking at bacterial overgrowths. And gut is such, one thing that I often see gets very under-screened, and certainly through standard therapy, if a couple goes through IVF, it never really gets looked at, is gut. And yet most of our hormones are conjugated, made, excreted in the gut. Most of our immune system is in the gut. To the tune of 85% of our immune system is actually in the gut. So if the microbiome isn't working effectively, and there's been some really great studies done recently about the impact of imbalances in the microbiome in the gut and the inability to carry a healthy pregnancy to term. So the increased risk of miscarriage as well as the risk of infertility. So I know for a fact when our patients come to us that is one such important area to look at and address. And again, I know that when we often, don't get the same kind of level of result, and we certainly don't get it as quickly as we need to. So correlating symptoms with what tests we might need to do also is going to be extremely important for getting the ultimate outcome that we're looking for, right? So I hope this is all making sense, right? And mind you, I hope that I have already answered the question of, Should my partner also be screened? Should they also be tested? 100%. Sperm is not enough. And in fact, for those of you who are interested in understanding more about male fertility and how male fertility needs to be screened and tested, and what kind of parameters in terms of sperm you need to understand, I highly recommend you listen to the Ask Gabriela Rosa that I did on male factor fertility, because I've gone through in great detail everything that you need to know there. But men need to be tested just as much. Often when we see couples who have been trying for more than 2 years, have experienced miscarriages, have, gone through many failed treatments, nothing has worked, they come back. If they have a semen analysis, I'm doing a hoop hooray, like it's amazing, right? But typically, we'll see men who have had a semen analysis and that's it. And we don't know anything about the rest of the status of their health and how all of these other parts that we know are so correlated to taking home a healthy pregnancy are actually playing out, right? So it's so important to make sure that we're doing all of those different kinds of checks and balances across both prospective parents, not just one, because fertility is a team sport. Right? So that's really, really key. So stools, bodily tissues is another one. I mean, obviously, if you have a growth, if you have a cyst, if you have something that, shouldn't be there, we need to test those things further. And sometimes we need to understand whether they, need further treatment, they're pathological or whatever it is that we might need to deal with. Typically, when somebody goes for surgery and if there are samples, biopsies taken, for example, NK cells in endometrial cells are going all to be done via testing bodily tissue. Okay, so that's one of the areas that definitely gets looked into, or that, in my opinion, often need to be looked into. Okay, then there's imaging. Things like MRIs, which I talked about in terms of prolactin, for example. You wouldn't go straight into an MRI just as a screen. So that's where, that second step that I talked about in terms of like the 5 steps of how you get testing done and how you kind of manage all of that, needs to happen in a staged manner, because a patient presenting for treatment, for screening and diagnosis and treatment, they're not necessarily going to need an MRI, right? They may need an MRI, but they might not necessarily, and therefore we don't just go there first off. So that's where that staging needs to happen. Ultrasounds, we're looking at pelvic ultrasounds and anatomical issues that might be present and that need to be looked into. Tubal factors, whether the tubes are clear and patent, all of that is either going to be done by X-ray or ultrasound. We prefer ultrasound wherever possible, but certainly can also be done by an HSG. And, I prefer a high-COSY ultrasound because of the less radiation, the better. But sometimes it's not possible. Sometimes we have to go down an HSG path. The one thing I will say is this. Fallopian tubes, whether you test them via laparoscopy, whether you do it via high-COSY, whether you do it by HSG, what's going to happen is that fallopian tubes are smooth muscle. They contract, and sometimes they can actually spasm in the middle of the test, which can give us also a false positive result. So you could be told that you have blocked fallopian tubes, but actually your fallopian tubes were just spasming at the time of the test. And that is very possible. And that's when people are told, oh, you have blocked fallopian tubes, you're not going to conceive without IVF, and they go and get pregnant. Typically it's because during the test, their tubes were spasming and they weren't actually blocked. Okay, so those are also things that need to be taken into consideration. That's also why I say that often one test, which is one moment in time, isn't necessarily enough to give us a conclusive piece of evidence in terms of that particular situation. Sometimes we actually do need to fine tune, tweak, and even test further. Okay, so all of those things need to kind of be put together, and that's the importance of correlating all of it. Because if we don't do that, then guess what? We just keep going around in circles, yeah? So like I said before, surgery is also a part of that for some couples, but surgery should never be a primary resort, a first resort. It should actually be done after all of the other steps have been taken in place. And sometimes, like I had a conversation with a couple yesterday whose situation I assessed, and they're like, oh, I think I shouldn't do this first. I actually think I should go and do a laparoscopy first. I'm like, no, you have so many minor factors that haven't been ruled out yet. Even if you go and do a laparoscopy, and let's say, for example, if we find that there is endometriosis, your body's in a much better place. You go and you have a laparoscopy and you have it scraped or you have it removed, your chances of conceiving after that, after having done everything else, is going to be infinitely better than if you kind of put the horse in front, or the cart in front of the horse, if you know what I mean, right? If we do those things out of order. And an analogy that I like to use is like, how would you go about building your dream home? If you were to build your dream home, the first thing that you would do is you would envision it, right? You would think about it. What is it that I really want? What does it look like? And you would then probably contract an architect to put your ideas and your plans, and also add their ideas and their plans to a blueprint and put it on paper. The next step is you'd contract a builder, right? That builder would then get other contractors, get building materials, you would start the process of putting it all together in a certain form, in a certain format. You certainly wouldn't want to paint the wall before you actually erected it, right? And many couples on the fertility journey, as ridiculous as that might sound, that is how most couples approach the process of understanding what needs to be done about their fertility and changing it. And because they don't know, and they shouldn't have to know. I mean, that's not their job, right? But that systematic, methodical process of, what comes first, what comes next, and what comes after is one of the key reasons as to why people continue to go around in circles, because they feel like they want to contract the interior designer before the walls have actually even gone up. Right? How do you get a sense of the room? Sure, you can look at the plans, but does it give you a proper, true sense of what's going on? And often the answer is no. Okay, so those are some of the things that we're looking at. And then, when it comes back to the end of the story, what happens? We've tested, now what? So the biggest thing here, and this is the hugest takeaway that I can recommend for you in figuring out, have I had not only all of my testing done, but has it been done properly, is to ask yourself, that 5-step process that I've taken you through, right? Was that properly taken into consideration? Was it properly followed through? Very frequently, the answer is no. Okay. And so what not to do is to try and piece it all together yourself. I mean, think about your dream home. If it's your expertise to put plans together, then fantastic. Sure, go put plans together, but it's probably not going to be your expertise to build it, right? It's probably not going to be your expertise to do all of the plumbing or all of the electricals or all of the painting or all of, so ultimately what needs to happen is that you will need to really get a specific set of expertise that is going to support you in doing just that. Because otherwise, if you don't do that, guess what happens? We're wasting precious resources, right? We're wasting time, effort, money, and of course, creating a whole lot more heartache than what's necessary, right? And when people try and piece it together themselves, I often see that this is what ends up happening. So I highly recommend that is one thing that you don't try and do yourself, right? So who should you get to help you analyze those results? Well, someone you trust who will be able to actually really categorically tell you, okay, this is a 5-step process in place, done. And it's done until, remember, the outcome is not to get pregnant. The outcome is not to find out what the problems are. The outcome, when we know we're done, is then we're holding that baby, right? And so for our patients, that's exactly what we do. We do what we need to do until, right? Not if we get our baby. Like, we're fine-tuning and tweaking, and that last, kind of little step, that the monitoring and the readjusting and retesting and reorganizing happens until, right? So that is the thing that I would highly recommend, is that you find a team, whoever it is that you want to work with, that is going to follow it through, right? In terms of our particular program, of course, this is what we do. It's very personalized, it's very customized, but it's completely up to you who you choose to be on your team. The key aspect, and this is one thing that I say all the time, like, we get more inquiries than we can fulfill in terms of our program. But what happens is that what we want is for people to understand and get the education, right? If it calls to you, if you feel like, yes, this feels like the right path and I'd like to know more, by all means, have a chat with my team. That would be great. And, they can figure out if we can help and how to do that, if that is the case. But we will always assess a situation first. That is the key thing. The reason why our success rate, I'll be very honest, the reason why our success rate is so high is because we have identified very specific types of cases and patients that we do our best work for, and that our methodology is a perfect fit for. Right. And so before we actually ever would offer a couple of places in the program, we actually do a full complementary assessment of their situation to figure out, okay, is this work that we can do? First of all, is there work to be done? Second of all, is this work that we can do? Have we seen this before? Have we gotten results with this type of situation before? If the answer is yes, then fantastic. You get invited to attend an information session to understand more about the program. But if the answer is no, like right there and then, I will basically be giving recommendations as to what else I think you should do, because this won't be it. Right. And so my purpose is not actually to get people to join my program. It's actually to figure out, okay, well, who can we best help? So that is the first thing. Now, education is key. And I always say this because Instagram has gone off. I always say this because people try to, like I said before, it's that whole kind of, cart before the horse thing. We want to make sure that you understand enough so that you can make good decisions for yourself on your journey. Right? And that is going to be key. So with that, I would highly recommend, if you have never done the Fertility Challenge before, or even if you have done it, but you need to brush up on some of the things that you have learned or you need to further implement, then the next one's coming up, October 30. Join us. It's completely free. It's online. It's available to patients all over the world. Super easy to register. So if you just go on a URL, fertilitychallenge.online, so just type in fertilitychallenge.online/register. You will find out more information, what it's all about, and you'll be able to register. And just join me, do the challenge, because it will give you some really great resources to understand what it is that you can do to change your situation once and for all. And that truly is the one thing that I wish for you, right? Is to really get the understanding, to break through that whole piece of, I don't know what I don't know. Because people come to me and they say, I've tried everything and nothing has worked, because they don't know what they don't know. Right? So let that not be you, because in that, there's a lot of waste. Okay. So I hope this makes sense. I hope it gives you an overview and insight as to what is important in terms of testing, what it is that you need to understand and look at and look for, and also to know whether the team treating you, whether they have a full approach, a comprehensive approach that is going to best support you, right? If you feel that that is not the case, by all means, reach out to our team. We would be happy to assess your situation. You can book a time to have a chat with one of my team. It's very simple. Just type in a URL, thefertile.me/chat, right? So it's very easy. You can just book a time, have a conversation. They'll give you a call. It's 10 minutes. They'll be able to kind of figure out whether that's something that, we need to look at further, whether your type of situation is something that we can actually help. And if so, they will let you know the next steps. So it's thefertile.me/chat. And lastly, before anything else, the book is coming out. The official launch date is the 7th of November. Those of you who have gone for the pre-order, which most people who have done it through the website, thefertile.me/book pre-order. So make sure that if that's something that you want, you get some extra goodies that you wouldn't get anywhere else, of course. So make sure you reach out for the pre-order if that's something that calls out to you. In the meantime, I really want you to remember just one thing. Education is absolutely key to move over that paradoxical, I don't know what I don't know, and stop going around in circles. So keep learning, keep growing, keep implementing. And until next time, bye for now.